Effective communication is vital in health and social care settings. It helps build strong relationships between care workers and service users. Discover how communication techniques can enhance collaboration and care quality. Communication in health and social care involves various forms such as verbal, nonverbal, and written methods. It includes interactions between professionals and service users, as well as among colleagues. Effective communication is crucial for providing quality care and ensuring that messages are understood. Techniques like body language, signing, and technology play a role. Understanding these methods is essential for all care providers. Verbal communication includes face-to-face interactions and telephonic conversations. Nonverbal cues like body language, eye contact, and facial expressions are equally important. These methods help convey empathy and understanding. Care workers must be adept at using both forms to support service users effectively. Mastering these skills enhances the overall care experience. Written communication is essential for record-keeping and formal exchanges. It involves preparing reports and maintaining documentation. Clarity and accuracy in written communication are vital. Care workers use this method to ensure information is accurately conveyed. It supports transparency and accountability in care settings. Technology aids communication through devices like electronic communicators and hearing aids. These tools support individuals with disabilities in sending and receiving messages. Social media platforms also enhance communication among care teams. Technology bridges gaps in traditional communication methods. It ensures inclusivity and accessibility for all service users. British Sign Language and other augmentative methods are crucial for individuals with hearing impairments. These methods facilitate communication and independence. Technology is advancing to support these approaches further. However, understanding the individual needs of service users is essential. Care workers must adapt to these methods to provide effective support. Symbols and objects of reference are vital communication tools for those who cannot speak. They provide a visual representation of messages. Objects like toys or jewelry hold special meanings for individuals. These tools help convey emotions and memories. Care workers use them to enhance understanding and connection. Addressing these barriers is crucial for effective communication. Care workers must identify and overcome these challenges to improve interactions. Overcoming communication barriers involves adapting to individual needs. This may include using translators or adjusting the environment. Care workers should be aware of cultural differences and language preferences. Building a supportive atmosphere enhances communication. Effective strategies lead to better care outcomes. Confidentiality is a cornerstone of communication in care settings. It involves respecting the privacy of service users. Care workers must handle information sensitively and share it only when necessary. Understanding confidentiality laws is crucial. This ensures trust and safety in care environments. Accurate information handling is vital for maintaining confidentiality. Care workers must record and store data securely. Access to information should be restricted to authorized personnel. Proper documentation supports effective care delivery. It also ensures compliance with legal standards. Adhering to legal standards protects service users' rights. It also reinforces the ethical framework of care practices. In certain situations, breaking confidentiality may be necessary. This includes instances where safety is at risk. Care workers must balance confidentiality with duty of care. Reporting concerns to supervisors is crucial. This ensures the well-being of service users and upholds ethical standards. Imagine a care worker discovers signs of abuse in a service user. The user requests confidentiality, but the worker must act. This scenario highlights the conflict between privacy and safety. Care workers must prioritize the user's well-being. Reporting the issue is essential for protection. In cases of abuse, care workers must override confidentiality. This protects the service user from further harm. Explaining the need for action is important. Care workers should reassure users of their intentions. Acting within legal and ethical boundaries is critical. Several factors influence confidentiality in care settings. These include consent, safeguarding, and legal knowledge. Care workers must be aware of these elements. Proper training ensures adherence to confidentiality principles. This supports trust and ethical care delivery. Care workers can employ strategies to overcome communication barriers. This includes checking for understanding and using clear language. Respecting individuals' communication preferences is vital. Creating a distraction-free environment aids communication. These strategies enhance interaction and care quality. Sensory impairments can hinder communication in care settings. Care workers must be attentive to these needs. Using aids like hearing loops can improve interactions. Understanding each individual's requirements is essential. This ensures effective communication despite impairments. Cultural and language differences present communication challenges. Care workers should be sensitive to these variations. Using interpreters or learning basic phrases can help. Understanding cultural contexts enhances interactions. This fosters inclusivity and better care delivery. The physical environment affects communication effectiveness. Noisy or poorly lit spaces can hinder interactions. Care workers should create comfortable settings for communication. Adjusting the environment supports better understanding. This leads to improved care experiences. In conclusion, this approach enhances both care delivery and service user satisfaction. Thank you for watching the video.